The Philippines has faced many epic challenges within the past several years, such as war and natural calamities. But after those battles, no one knows that there would be another fight to come that will change the way of living, not just only in the Philippines but also in our whole world. This is Group 2 Documentary Specials, The COVID-19 Pandemic, a Philippine Experience. Recently, in the year 2020, there was a virus which is believed to be from Wuhan, China. This virus was spreading all around the globe, infecting many people and taking many lives. According to World Health Organization, coronavirus disease or COVID-19 is an infectious disease caused by severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. The virus can pass from one person to another by infected person's mouth or nose in small liquid particles. Most people infected with the virus will experience mild to moderate respiratory illness, while older people and those with underlying medical conditions are more likely to develop serious illness. Moreover, in December 2019, the first known case of COVID-19 was identified in Wuhan, China. The disease has since spread worldwide, including the Philippines country, and led to an ongoing pandemic. When did the COVID-19 reach the Philippines? According to case report from Tropical Medicine and Health, the first two suspected cases in the Philippines was investigated on January 22, 2020, and both admitted to the National Infectious Disease Referral Hospital in Manila. Then later on, it was confirmed that they are from Wuhan, China, and considered as the first COVID-19 patients. Because of this matter, Philippine President Rodrigo Duterte has ordered the imposition of a temporary ban on Chinese nationals from China's Hubei province, where Wuhan City, the epicenter of the novel coronavirus outbreak, is located, as well as from other parts of China where the spread of the new coronavirus has been reported, as Inquirer.net stated to their article. However, based from Department of Health statistics, today, in the making of this video, we have a total of 2,797,986 confirmed COVID cases in the Philippines, and 97.1% of these cases are healed, while 1.58% are deaths and 1.3% are active cases, cited by Republic of the Philippines Department of Health. And because of these statistics, the country imposed a strict lockdown in the capital and nearby provinces. Presidential spokesperson Harry Roque announced the lockdown after the country reported COVID-19 cases. More than 25 million people across Metro Manila and nearby provinces will be affected by the lockdown. The measures include a curfew from 10 p.m. until 5 a.m. Gatherings of more than 10 people outside are not allowed, and non-household members cannot gather indoors, the government said. Diners are not allowed to eat in restaurants, although takeouts and delivery services can go ahead. The Philippine National Police has deployed thousands of officers in checkpoint areas to help enforce the rules, according to a PNA report. Because of these lockdowns and strict implementation of rules, over 1 million of Filipino people will force to stop their job and will result to the rise of hunger and poverty in the country. According to CNN Philippines article online on September 10, 2020, the National Economic and Development Authority said more Filipinos could slip into poverty and joblessness until 2021 due to the COVID-19 pandemic. However, during the Senate budget hearing, Acting Socio-Economic Planning Secretary Carl Kendrick Chua said there will be some temporary increase in the poverty rate and people living in the capital region and megacities will be mostly affected. But how risky is coronavirus to the Philippines? Due to its proximity to China, the Philippines is at a greater risk of witnessing increased cases of the novel coronavirus infection compared to other countries. The Philippines also has Chinese nationals that working in the Philippine offshore and gambling operations. Aside from that, more than 230,000 migrants Filipinos, often referred to as Overseas Filipino Workers or OFW, are also working in China, particularly Hong Kong and Macau, as household workers. That is why a temporary ban was imposed on the workers from traveling to China or its special administrative regions after the coronavirus outbreak on February. With this continuous growing pandemic, Philippines has suffered a lot, making the 90% of its economy goes down. According to Brookings.edu, the Philippines has had the world's longest lockdowns during the pandemic. Yet, it has failed to flatten its COVID-19 curve based on statistics. The economic model of the Philippines appears more vulnerable to disease outbreak, and pandemic handling was also problematic. Because of implemented restrictions policies, the country seems stuck with on-off lockdown cycle, which are severely damaging the economy because this puts more pressure on its population that stumbled from job displacement and long-term risks on human development, and this causes the hunger to rise in the country. According to Rappler, Philippine state economies see unemployment staying elevated and more people remaining below the poverty line until 2022 as the coronavirus pandemic leaves scars on the economy. However, when it comes into mental health, do you think that COVID-19 has an impact on our mental health? Well, according to the Business World article, they interviewed a 24-year-old man that was diagnosed with a general anxiety disorder in December 2020 because of the coronavirus pandemic. The man stated, "Seeing so many of my friends getting sick from the coronavirus was scary. The lockdown made me feel tired and anxious about what's going to happen to me. I'm now taking medications to control my condition." However, the article added that at least 3.6 million Filipinos suffer from one kind of mental, neurological, and substance use disorder, the health department has said. Moreover, mental health impact of the pandemic will be long-term and far-reaching, the World Health Organization said in a statement last month, as experts and leaders sought action on pandemic-linked anxiety and stress, quoted that everyone is affected in one way or another. Aside from mental health, let's take a look on the Philippine health workers side. According to an article from Rappler, on August 2020, Dr. Mario Panaligan, a president of the Philippine College of Physicians, writes a letter that expresses, "The Philippine healthcare system is already overwhelmed, and the healthcare workers are united in sounding a distress signals to the nation." However, it's clear that our country's frontliners need all the help that they can get. However, Green Cross Incorporation, through their Together We Are Stronger program, has deployed donations to hospitals across the country. With all this problem and struggles in the Philippines, we have to respect and salute all of the frontliners for being a hero for all of us in this moment of pandemic. But we need to hear something from them also. We have here our very own Cadet Magguling with his interview with a medical frontliner.
As I have my interview with a 28 years old, single, far woman from Ifugao Province, Philippines, and still living with her family, spending already 2 years in the service, and for privacy purposes, we will just introduce her as Ma'am Amy. When I asked her about her experiences during this time of pandemic as a far woman, she stated that this pandemic brought mental and emotional challenges to everyone, even to frontliners, because of isolation, quarantines, and long days at work without proper rest and enough time for the family. Hence, she also added, the pandemic has made me realize what matters most in life, which is the family. Moreover, when I asked her what is her reason to continue her job, she said, I was hired and trained to give out public services, and with this pandemic, it is not a hindrance for me. Perhaps I will continue my job and stay with it because it is my passion.
After that, we have another interview, but this time with an economic frontliner. Here is Cadet Redoble to narrate to you.
As I have an interview with Mara Fidel Cruz, a 15-year-old woman from Batasan Hills, working as a task force disciplina for 2 years and living with her husband and children. When I first asked her what is her job description, she said, our work is reminding people to always wear a face mask and face shield, but sometimes they ignore and disobey us and even get angry at us. But eventually they follow and already obeying the health protocols. When I asked her what is her reason to continue her job, she said, I just want to help despite of my age and the risk of COVID-19 because the police and other authorities isn't enough. So I joined the task force disciplina. She also added that her family wants her to quit her work, but she insists that she really wants to help people.
Why did the events turn out the way they did? For us, the main reason why such events turn out the way it is today is because of human negligence. We've all not expecting this situation to happen, but it is happened and we don't have the time to blame anything or anyone, but to accept the challenge of the world and become the best versions of ourselves. We thought that this challenge in life will make us stronger and better. We know that we can fight this challenge and we will win. As we remember the quote, nothing is impossible. The world itself says I'm possible. And we strongly believe that we the humans will win in this global pandemic that is happening today. However, for us cadets, we want to share some of our own personal experiences during this pandemic too. Starting with me, Cadet Iqbal. Well, for me, this pandemic brought us to the dark side of life, but it is also a way for us to know ourselves more and define where is our limits at. Despite of this pandemic that we have today, I thought to myself that I am still blessed for being healthy and I have never had a COVID disease until now. However, my mental and emotional health slightly affected by this pandemic. Because of the lockdowns, I couldn't have an opportunity to see my friends personally and see the outside world again. But I thought to myself that it is all about mental strength. the strength of resisting temptations, and the strength to adapt in a new normal life like this that we have today. I have learned a lot of disciplines in this pandemic, and it gives me an opportunity to know myself more and become a better person than I was before.
This pandemic brought me several problems like lack of concentration in academics, loss of income in our family, and lack of exercise. Probably because all sports or outdoor sports are closed during the ICQ. As a result, I have been addicted to mobile games and do always like to sleep, in which I become lazier in doing household chores. However, it didn't take long for me to overcome the challenges in myself. I created a daily routine which I promised myself to follow it for the sake of improving. Therefore, I am no longer lazy and a sleepyhead.
Pandemic is a good and bad impact for me and my family. Let's start with me personally. Of course, again, I can do some exercise outdoor, which is I used to do before, going to gym. Some of my family lost their job for months because of the lockdown, but they eventually came back after the long lockdown. On the good side, I enjoyed those lockdowns. I'm with my family and we bonded well. We have lots of time to bond together, watch movies together, even play games. Now, the pandemic is slowly coming to an end. Slowly doing the things that I used to do before, exercising outdoor. I hope this pandemic will surely come to an end for us to go in MMMA to study.
Actually, it helped me to realize a lot of things, but to be honest, pandemic really made me the most depressed person because I always feel like I'm all alone, that I have nobody to hold when I'm drowning on my own thoughts.
I am Cadet Magiano and I had been given to share my experiences during this pandemic. As a lot of people, I am also experiencing some difficulties in life, especially in school. I really miss to study face-to-face class and interact with classmates to create bonding with them. But the fact, I am now enjoying myself at home because I have a lot of time to waste, like playing online games, after doing some school activities, watching on TikTok or Facebook, and I can also visit some places that I want anytime. But I am worried to my parents because their jobs are affected through this COVID-19 outbreak, and I am sad to their situation.
I face difficulties adjusting in my studies from modular to online class. Especially in our place, we have a poor signal connection. Despite this, I still try my best to accomplish my given works. During this pandemic, we face a lot of challenges. Through these challenges, we learn a lot of lessons that we apply in our daily life. All we need is to keep fighting and staying strong.
Hello, my name is Cadet Win Gabriel Tarazona from Section ME 1D, and this is my experience during the pandemic. My experience during the pandemic, at first even now, I still have to adjust. When the pandemic started, my dad lost his job as a Grab driver. It was the only income that day. It was the only source of income that day. So my parents have to come up with a new idea to have a new source of income. So my mother knows how to bake, and so she started to selling baked goods. And my father put up an accessory shop because he was encouraged by our sister-in-law, but unfortunately it didn't sell much, so we have to close it. In the bright side, my mother's business was a success, and she started a partnership with GrabFood and Food Panda. so far it's doing great. When the education was changed to online class, I was having difficulties because the environment was different and etc. During the pandemic, I had more time at home with my family to bond. Since I have more time, I always wanted to learn how to ride a motorcycle, so I did that. But unfortunately it wasn't running, so I took it apart and started fixing it. So I managed to make it run again. I was proud of myself, and in that day I knew that fixing machineries was my favorite thing to do, and I knew that I should switch from I knew that I should switch from marine transportation to marine engineering. So far, I'm not regretting my decision. I'm enjoying it so far. In conclusion, my experience during the pandemic had a lot of highs and lows, and it will be a memorable experience. That's all. Thank you.